welcome everyone. Really great to be here. Thank you so much to St Martin's in the Fields Frontline Network for having us and inviting us to talk today. Yeah, we're Mac UK. I'm Jake, and this is Jess. I think what we'll do, I'll introduce myself really briefly and give you a little bit of a personal context of where I'm coming from in the work, and then hand over to Jess. So I'm the Public Health and Prevention Lead at Mac UK. Mac UK is a mental health charity. We'll introduce who we are in a second. But yeah, I kind of came to this work through essentially as a child or young person myself. My dad was homeless for a long time, and he was squatting and in various different housing structures, in co-op housing, and and also kind of experienced like quite severe mental health issues and abuse, and had been placed in the care system briefly as a child. And I kind of never really had an intention of working within homelessness or in mental health, and that path kind of like made itself apparent to me. I moved to Bristol and was noticed that the homeless community was really kind of vibrant there, and people out and about a lot, and it was there was a kind of quite a collaborative kind of feel within the city, and I ended up spending a lot of time just like with the homeless community there, and then started working with young people in a hostel. So working with young people in care specifically who'd experienced severe abuse as well, and then moved back to London and got a job at Mac UK, thinking about the ways in which inequality impacts mental health, and we'll get into a little bit about that throughout the day. So yeah, I really encourage everyone to get involved in the chat and ask us any questions. We'll be throwing some questions out there, so as much interaction as possible would be really great. I'll pass over to Jess to introduce herself.
Hi everyone, I'm Jess. I'm a trainee clinical psychologist, currently in my final year of the doctorate at UCL, and on my placement at Mac UK, working really closely with Jake on a partnership project with a housing organisation, which you'll hear more about today. But the aim is to really embed kind of an approach to mental health and supporting mental health at different levels of the organisation, and sharing some of the ways we've worked in the past that has worked well, particularly with people from sort of socially excluded groups. I've got a background in support work and some youth work as well. And really enjoying this way of working. I think there's a lot of value in one-to-one therapy, but often, as we'll talk about today, it feels like there's so much more that needs to be done outside of that to really support people's mental health. And Mac UK are quite experienced at doing that work, and hopefully we can share some of those ways of working today. My research specialism has been looking into benefit stigma and its impact on mental health, and I'm also going to be talking a little bit about that shortly. It's really great to have a chance to speak with you all today. I just want to shout out our youth consultant, Khaled, who contributed some really valuable components of this presentation. So thank you so much, Khaled. I think you're in the audience, so big up for you. And also other members of our team, Nineb and Tess, who contributed to this presentation. Thanks so much, and to St Martin's in the Field for having us. Next slide, please. So whilst Elizabeth is changing the slide, it hasn't updated for me, so I don't know if it's happened yet for everyone else, but it's our hopes for the day. There we go, thank you. So today, the first part of today is kind of introducing our contextual approach to understanding mental health, drawing from a public health lens and thinking about the intersections between mental health and housing. And the second half is going to be thinking a bit more about how we intervene then if we're taking a contextual approach to mental health, what that looks like, thinking about co-production as a therapeutic tool in itself, and also thinking about working at multiple levels of organizations and systems to support that work. Yeah, so throughout this session, there's a Q&A box, which you can, if you've got questions, you can put them in there and we'll come back to them at the end of the session. Any we're unable to answer, I believe we can also try and respond and get those responses to you. Throughout the session, we're also going to try and make it a bit interactive. So there's a chat box, which is separate to the Q&A box, where you can kind of share as you have been doing already. And yeah, sort of engage with each other a little bit as well as we go through. Thank you. Next slide, please. And over to Jake.
Sweet. Yeah. And as well, if there's anything that you would particularly like to know as the day goes, as the session goes on, like, please, yeah, feel free to just shout out in the chat. So essentially, yeah, we're Mac UK, and we started 15 years ago. We were started essentially because there was a recognition that young people who were coming out of the criminal justice system on their probation were assigned to access mental health support, and a large, I think 2/3 of the proportion of people who are on probation were not attending these sessions. And so the question kind of arose, like, why is this? And essentially the answer was because the services that were in place, the mental health services that were in place for these young men particularly, were inaccessible, and were not supportive to the context of those young people. And so what was done was that Charlie, who started it, was developed a relationship with a guy called Mark, and they were essentially built a project within the community in a local housing estate, and developed the first kind of Mac UK project, which is called Music and Change, which is why it's Mac. So what we really wanted to drive home as an introduction is that we take our way of working from various different areas, thinking about youth work initially, and co-production, I guess, were the two kind of foundational principles, along with psychology. So initially the Mac UK was kind of positioning itself as like taking the therapeutic tools that were used in clinical psychology out of the clinic and into the community, and using those models with young people. And over the years, we have kind of developed our approach, and created something called the integrate approach, which is the kind of foundational model that we use. However, as we are like a learning organization, and as people should be, we're learning all the time. And over the past few years, we've started to kind of integrate, ironically, public health and community psychology approaches more into the fabric of what we do. So today we'll think mainly about public health and co-production, and particularly as it's St Martin's in the Fields, like as it relates to housing. And yeah, we'll talk a little bit about how co-production can be used as a kind of therapeutic tool in itself, and really kind of highlight that this is like a key tenet of everything we do. We think that by using co-production, you're able to produce something that is as meaningful as possible, and so we try and support young people to develop the services that they determine work best for them. This is through co-production and through employing young people, we articulate that as a kind of public health intervention as well. And we're going to think a little bit in more detail, like zooming out a little bit at population level, why that's really important. And yeah, the reason that we do things in this way is because like the context of young people's lives is really, really fundamental, and understanding that context is essential to being able to support those young people in the most effective way possible. And whilst we kind of, a lot of these ideas have not directly come from young people, they represent some of the kind of contextual understanding that we've gained over the years of working with the different communities we have. We also worked with Khalid. Yes, Khalid, if you're out there. Yeah, to illustrate some of the things around housing specifically that we'll be touching on. If you go to the next slide. So before we get into the co-production and public health stuff, I really wanted to, well, we thought it would be really important to just underpin like where we think clinical psychology and psychology in general has some pitfalls. It is really important. This is a diagram from Suman Fernando. If you don't know him, go check him out. He's an incredible theorist and academic. And yeah, I think it's really important to understand where we're coming from. So, we work with a lot of clinical psychologists within MAC UK, and we get trainee clinical psychologists. And I think it's really essential to understand the history of clinical psychology. And Western psychology was developed in the mid-19th century. So I'll give you a bit of context and history about that. It was developed in the mid-19th century as a branch of science concerned with the study of the mind, with its roots in America and Germany. Early psychology, known as experimental psychology, undertook experiments in laboratories in the pursuit of understanding human behavior. This in turn set the scene for behaviorism in psychology, which is a model that continues to be influential in the provision of mental health services and clinical psychology training today. It's important to emphasize how closely clinical psychology and psychiatry are bound up together, both in terms of their histories and their function in Western society. And they both arose in tandem within the general field of Western knowledge. This has informed their development within a medical model that reduces mental health in a lot of ways to its biological underpinnings, and I think misses the impact of inequality and the intersections of the intersectional needs of oppressed groups. The history of the medical model is associated with the eugenics movement, which viewed people with disabilities and people from racial groups that were not Nordic, Germanic, and Anglo-Saxon as genetically inferior. And this traces back to the theory that to the theory and psychological science of phrenology in the 1830s. So I think in order to really develop a critical lens of where we're coming from when using a public health approach to thinking about mental health, and especially when that intersects with housing, is really essential to understand where the notion of psychology has come from and where the notion of clinics and inpatient units comes from. And I think it's and the kind of impact that it's had on people who have experienced depression in throughout history. So that's just a little bit of a context of Western psychology and laying the foundations in this session to kind of show that we're looking at psychology from a different approach, but understanding that those are the kind of tensions that exist within the profession. If you move to the next slide, and yeah, over to you.
At MAC UK, we take a contextual approach to understanding mental health. So rather than positioning the difficulties within the individual, a contextual approach understands difficulties to be positioned in the context around that person. So what we're seeing in that person show up is a reflection of some of these more socio-political difficulties that people are facing. And I guess that in the image, it shows some examples and there are many more. And I wondered what people had, if you want to share in the chat, when working with people who are experiencing poor mental health, what kind of things in their social context, in the political context around them is influencing that, beyond what we're often taught to think about, which is kind of like thought processes and their behaviors and sort of these individual ways of thinking about mental health. Yeah, care experience, someone has said, whilst people are, yeah, good and bad working conditions. I think the last speakers spoke to that really well.
Just on care experience, like, I think the official figures say that it's something like half the people in prison have had care experience, and I think the reality is probably it's a lot more than that, and people don't disclose. And I think the same is probably true for inpatient units, like the disproportionate level of distress and the way that that is then treated by society is for young people who've experienced care is like really horrific in a lot of ways. And yeah, I think it's really important to focus on that.
Mm. Someone's also said sort of access to services, which is a lot of the thinking we do at Mac. And yeah, employment, which we'll talk a bit more about soon. While we're here on this point, there's one thing kind of missing from that image, which is to do with my research, which is around stigma and how there's kind of a growing evidence base for stigma to be a social determinant of health, of mental health, and cause of mental health inequalities. So my research was specifically looking at benefit stigma, finding that it has a significant impact on the mental health of claimants alongside other factors such as unemployment or precarious work or poor conditions of work, and also significant financial strain, as we know that the benefits that are provided aren't high enough to alleviate this. My research also looks at, and this is kind of joined up with a lot of other areas of stigma research, which are looking at the production of stigma in society. So moving away from thinking about stigma as just something that exists within the individual, to thinking about where is this produced, what structures and institutions are producing this, and for what purpose. So benefit stigma can be thought of as being produced and reproduced within certain structures. So the benefit system itself, for example, has features that are stigmatizing, such as punitive assessment processes, which brings into question the deservingness of claimants. And yeah, and that feeds into stigma. And it's also present sort of in media and political discourse, which has fueled kind of a quite largely held societal belief that there's tons of fraud happening when really the numbers are very small in terms of the fraud that's happening. So the implications of this research and the research of others for mental health in this specific example is thinking about anti-stigma campaigns that target these structural levels of stigma production, which contrast quite a lot to more traditional and commonly seen anti-stigma campaigns, which are a bit more about the individual, and really contrast to sort of a therapeutic intervention that might attempt to alleviate stigma just at that individual level. There are some really great examples of coalitional research groups that include people with lived experience, who have produced guidelines for reducing stigma at the structural level. And this includes the Stigma Free Futures Design Team and the Commission on Social Security, who've made a lot of suggestions for how to improve the benefit system and reduce some of those stigmatizing features, which in the context of my research should have an impact on mental health, and alleviate some of those difficulties. And just another, I guess, reference to the Deaths by Welfare campaign, who have collated a record of all the deaths that have been linked to benefit sanctions and cuts, and really kind of highlights the most extreme end of the impact of socio-political context, legislation and policy that can impact on mental health. Thank you. Next slide, please.
Yeah, so I think, and and thank you to everyone in the chat, because you've obviously got a really deep understanding of, like, you know, where kind of poor mental health proliferates, and the challenges that brings up when working in an environment where kind of resources really thin on the ground. Someone has mentioned, like, you know, demographic access to healthcare. And here I'm going to talk a little bit about the social determinants of you know, well-being. This is WHO statistics that was done by University of Wisconsin a while ago, that indicates that 40% of your health outcomes are determined by your socioeconomic factors. Obviously, what this kind of diagram fails to kind of illustrate is how interconnected these things are. And like you said in the chat, Ben, you know, your access to healthcare and your health behaviors are so deeply entrenched in your socioeconomic status that it's very hard to, like, separate those things apart. But through a public health lens, at least we start to gain a little bit of an understanding of, like, what at a population level, what health outcomes look like, and where you look at things like your environment, as Pamela said, like, not just green spaces, but actually, like, like access to community resources, playgrounds, nurseries, you know, hospitals that are, like, properly funded. Like, all of these things are so deeply, like, yeah, like, as I said, like, so deeply entrenched in what will make up your physical and your mental health, right? So kind of, yeah, like I say, looking at the kind of contextual factors that impact health are the social determinants. And I wanted to talk a little bit about the kind of various public health measures that are operating and that we might be aware of, right? So they operate on the secondary and tertiary level of public health intervention. And what I mean when I say that is, a secondary level is like a diversion. So thinking about how we change that 30% there, the health behaviors, right? So the individual choices that people are making that will reduce their health outcomes, or, like, you know, reduce their life expectancy, for example, or in mental health, yeah, kind of increase the chance of distress or, like, crisis. And tertiary is like the surveillance of that. If you're looking at public health, if you think about it like disease, it's about surveilling where it's proliferating and kind of trying to contain it. And those ways of operating are more widespread than the primary level of public health intervention, which is actually like a reduction and a prevention of these things occurring in the first place. And when we think about that, we're looking at a reduction in inequality in society. So if we think of, like, like banning advertising of smoking or the sugar tax, these are all measures that are put in place to alter the behaviors of the working class, essentially, to prevent what in public health would be determined disease, obesity, heart failure, etc., from spreading. And what I think is really important at a kind of policy level and a political level is how we can kind of illustrate that actually it's the inequality in itself that is causing the harm. And if you were to reduce that inequality, people's health outcomes would improve. So again, it's kind of what Jess had mentioned about, like, individualizing the behaviors on one hand, or identifying the root causes of the problem in the other. Next slide, please. Is this me?
Yeah, it's you.
Yeah, so essentially it's this, just to continue on, like, the social, because of the unequal distribution of resources, we are looking at, like, interventions, like I say, that instead of trying to kind of target individuals, we want to target the social and economic policies that would enable us to redistribute power and resources and reduce the social determinants and their impact on mental health. Next slide. No
So
problem.
we are going to come on to kind of how we work in this way shortly, because I'm sure that's the thing that will feel really important to everyone. But just wanted to, I think that from judging from what's going on in the chat, like a lot of this won't be new to you. Like this, you'll be seeing this every day in your work, right? But we wanted to give, I guess, some of the evidence base in case you're ever in need of drawing from that evidence base to back up. I guess trying to make a change in the service, for example, trying to kind of bring in this contextual way of responding to mental health and thinking about mental health, it could come in handy. So this is research from Psychologists Against Austerity, who are now called Psychologists for Social Change, who did a briefing paper where they collated the evidence for ways in which austerity policies are impacting mental health across society. And you can read their 5 sort of mechanisms for that happening. And I'm sure you'll already be kind of coming to mind lots of examples of this that you're seeing in work with the people you work with, and also perhaps for yourself as well. I know like we're not immune to these things as professionals in the sector. The next one again will not be new to you. Next slide, please. But just an evidence base for the factors that impact on mental health within housing. The next slide, please. So this is thinking about unemployment, precarious employment, and working conditions, which was mentioned in the chat earlier, and thinking there's an evidence base cited here for how these are linked to psychological distress. Next slide. And this one gives reference to some studies looking at the cumulative effect of racial discrimination on mental health, and also the cumulative effect of, I guess, various forms of discrimination if you have kind of multiple intersecting identities that are impacted by discrimination, and how this impacts on mental health. That list is not kind of exhaustive, but it's just a few of the key ones. Next slide, please. So this part of the presentation was co-produced with a youth consultant. I mean, he actually contributed to other parts, but this is really his voice here. So thank you so much for sharing. We thought through his experiences of precarious housing growing up. So he was in permanent housing between the ages of 3 and 18. And experienced, I think, at least 9 moves from what he can remember, moving borough, moving school, moving housing, until him and his family received permanent housing at age 18. You can read here some of the experiences that this involved for him, and some of the ways that it clearly and significantly impacted his mental health and well-being more generally. So thinking about kind of just the unpredictability of it, moving with no notice, and how kind of scary that felt, the impact it had on sort of education and friendships, and feeling unsettled and learning, not knowing, just not knowing, and the uncertainty being really impactful for well-being, and also kind of the physical impact. So there's a quote here: "I couldn't breathe, the mold was literally killing me," which I'm sure lots of people in this sector will be kind of familiar with, people experiencing really poor housing conditions. Next slide, please. I think a really big thing that came through to me was just that sense of powerlessness, like not to the point of not being able to have control over when a service provider might attend the house and enter and sort of fix something, and not knowing when that's happening, or having any control over when or how or who. And also this youth consultant described some quite difficult interactions with one of the local authorities they were in, that felt quite threatening and discriminatory, which I know can be, it's not uncommon, although there are other services doing brilliant jobs. These things do happen as well, really, unfortunately and sadly. And just the final point of this having a really long-lasting impact. So this youth consultant has been in permanent housing for a few years now, and still not decorated his room, because that's just was never possible. So yeah, thank you so much for sharing those experiences and helping us like really contextualize this.
Yeah, and I
Um,
think the one of the things that I've noticed, or that people have said to me when working with young people, like there's the reality is that people are not gonna, you know, the process of like dealing with the trauma of all of this is one that it takes a certain amount of like stability and kind of security to be able to start confronting it or like thinking about it or dealing with it, because when you're going through all those moves, and I'm sure everyone in the chat like understands this, like you're so on edge so much of the time and so unsure of like what's going to happen next, that you're continuously like, you know, ready to fight or flight almost, and like you have to be prepared for the next thing that's going to happen. And a quote from a young person I work with said, how am I meant to deal with trauma 536 when I haven't even been able to have the space to deal with trauma number one? And I think where Khalid was talking about the kind of interactions, the personal interactions with the local authority that felt discriminatory and felt threatening, that can happen on an individual level, but the violence is occurring at a systemic level. And I think in order to like deal with to think about like how we improve the kind of mental health of populations who are experiencing this, we have to think about how we develop safe and secure housing for people. And
Mm.
yeah, and just like moving on to the next slide.
One
Like,
moment, Jake. Someone's just said in the chat something of um, never having asked the client whether the housing that they got successfully housed into was better than rough sleeping. And it just made me think of the, I guess, the lack of kind of power and decisions when you're being allocated housing and moved around compared to rough sleeping, where maybe you are the one who's in charge of the decisions that day, and that sometimes being, you know, chosen over that because of the impact of not having power and not having a say, which really links to co-production as an intervention, which we'll come on to soon. So
yeah, and
thanks.
I think like that's a super important point, a super important reflection. And it's like it's kind of, you know, one of the reasons that I started working with the homeless population, because in Bristol there was a community of rough sleepers who were taking care of each other, right? Like they were out for each other. They had their like encampment, and they were like, people looked out for each other. There was a sense of safety and security within that population at that time. And it was like obviously very complicated by kind of, you know, um, like substance use and you know and mental health problems that were kind of had occurred potentially from childhood or through the context. But there was a sense of autonomy that I think is like super important. Yeah, exactly. Like you're the and with this slide is I wanted to think a little bit about hostel accommodation, and like, you know, having worked in hostels for 10 years plus, you know, I was working at one hostel that whose offices were in incredibly plush buildings worth millions of pounds probably in London, and the hostel was down the road, and the hostel was covered. It was like blood on the walls. They couldn't get a plumber out. There were leaks. There were, you know, it was terrible conditions. And often I thought, like, what chance do people coming out of, you know, sleeping rough into this environment have? And like, you know, and how long they have to wait to get temporary accommodation in the borough that they're local, you know, that they have a local connection to. Like these things are so deeply entrenched in our society, and you know, I think that there is a real important thing to think about when we think about what good quality housing is. And I would like people to, in the chat, potentially to kind of think about like, all right, well, what would good quality housing look like to you? These are some of the thoughts from Khalid about like, you know, being able to have ownership of the space and good conditions, enough space, bit of community support, a bit of community, a bit of support, cultural connections. But yeah, just anyone in the chat, like, you know, what are some of the features of like good housing that you could imagine and that you would kind of want for yourselves, and that would be supportive, like, to your own mental health. Moving on, please. Jess, I can't lie, we are bang on time here.
I know, I'm like, yeah,
So,
well, so
um,
surprised.
so yeah, so now we're gonna move on a little bit to talking about and you guys all, so yeah, just in the chat somewhere, warm, having choice, like these things are so important, right? Like warmth, I mean, is that something, that shouldn't be a luxury to people, you know what I mean? Like even in with secure housing and a secure employment that I've experienced, still when the bills went up, you're just like, how am I, like, what's the, I'm one paycheck away, you know what I mean? Being near friends and family, having community, I think that is something that is really, really important. And with the decade of austerity that we've just experienced or more, um, community centers, youth centers, and those spaces being closed down where people were able to congregate and share and build relationships, that is, I can't kind of underline how important that is in order for communities to kind of support each other, because that, as much as the state should be providing housing to people, also they should be like, there should be the facilitation of actual community work that is done kind of organically. Anyway, sorry, getting a little bit distracted, having said we were on time. So yeah, now we're going to think a little bit about like when and where to intervene and how we respond to mental health, particularly in the context of housing. I'm loving all the stuff in the chat, really, really important. Yeah, great. Really, I think that's it, Stephen. It's like, there is a thing of like dignity that also I think is really, really important, and Jess touched on it with stigma. Like I think that's a really fundamental thing to people's like well-being, is like not feeling like they are just like disposable, or like, yeah. Anyway, sorry. Co-production. So if you go to the next slide, please. This is Sophie Bass's illustrations, by the way, if you into them. So co-production is a tool. Yeah, we're going to talk a little bit about how we create services, how we co-produce services that best meet the needs of the communities, and hopefully rebuilding autonomy for people who may have had this taken away from them throughout their lives. So co-production, when properly used and implemented, can be really transformative for people's mental health. It's a way to both like develop better services that are kind of more effective for those that they are trying to serve. But more than that, it's a process that facilitates the rebuilding of autonomy. And when we are thinking about people who may have had autonomy taken away from them throughout their lives, from the very moment of they were born, services like children's social care, as overstretched as they are and as hardworking as social workers are, often with care experienced young people, they can feel like the decisions are made like for them, right? Within mental health institutions, things as simple as like, what time you go to bed or your movement, like all of these things are restricted. And so people build up like a relationship to state infrastructure particularly, but also just general other services, that they're there and they're going to take power away from that person. And I think what is really fundamental is how we can like redistribute that power into the hands of the people that have had it taken away from them in the past. And co-production is a good, not perfect, but a good way of beginning that process. It's a way that you can potentially kind of support people to leverage power for themselves in order to take charge of their own care in a way that works for them. But it's slow, and it requires investment and time, but it is effective. And like through co-production, young people that we work with are able to develop the skills that support them in their lives, as well as have an opportunity to have conversations about their lives and that in itself is a therapeutic process. And when we say co-production, we're talking about, employing young people to develop services. Essentially, that's what we're saying when we're talking about co-production within our context.
So that's another way sorry, Jake, that's another way that it is an intervention for mental health, because if we think about the evidence base for financial insecurity, financial strain being a social determinant of mental health, then employing a young person who's having housing difficulties, homeless, or experiencing mental health difficulties will be a way to intervene at that level, as long as that employment is scaffolded and supported to the level that they need to make it kind of so that they can meaningfully contribute. Should we go to the next slide? Thank you. So this is an example of like the different levels that co-production or participation can happen. There's no consistent definition of service user involvement, and it's not required in the healthcare policy or legislation. Although at the moment for young people, it is being built into sort of Ofsted requirements. So there is, I guess, a structural level push that is supportive of the work we do at the moment. But this often means that service user involvement co-production is falling more at the bottom rungs of the ladder. And this is, of course, also to do with the context that this sector is in, being really stretched and under-resourced. And this work requires a lot of resource for it to be done meaningfully and to get to the higher rungs of the ladder. So lower down the ladder are examples of kind of where power is withheld from clients and decisions are made for them. Perhaps decisions are made and then sort of shared to the client as sort of to give a bit of an afterthought contribution. And that's kind of not an example of like true co-production. And at these lower rungs of the ladder is where kind of the possibility for human rights breaches or that are more serious like come in. The lower down you are, the less power that people using the service have. Reaching the higher levels of the ladder requires acknowledging that clients can hold the solutions to the problems that they face and can make significant contributions towards some of these solutions. And it also requires that people at the top of services and staff teams and managers really believe this and are willing to share power, resources, and tools in order for that to happen. And we're going to think a bit about some examples of how we work in this way shortly. Yeah, I think that was everything for this slide. Thank you. Next slide.
So yeah, and also in the Q&A there was a request to think about some of the challenges that are faced when we're doing co-production, and we'll definitely touch on that. So I haven't forgotten. But yeah, so this is part of the integrate approach. So thinking about how co-production looks in practice. So there are some other kind of models that we use as part of the integrate approach, but this particularly when working with young people is how how we do it and the steps that we take. And I think what is really important is that like the relationship building is done very, very like intentionally, and it is prioritized in a lot of ways, because I think, and again, it's about time, but I think that's something that can often be missed, is like actually that time spent with a young person is really fundamental to this, the building blocks of like your relationship, and that you won't be able to get anything done if you can't build like a trusted relationship with young people. And then through that, the goal, the aim kind of is to support young people to kind of develop and design and lead on a range of activities of their choice. Street therapy is something that we've kind of moved away from, but like when young people are designing those activities and we're employing them to do that, we're also thinking about like the network alignment and scaffolding and bridging the network of that young person with the young person and with each other, and really thinking about like system mapping, and that is like a formal and informal process. And then, you know, supporting young people to kind of lead on social action and social change, with like once that relationship is built and that employment kind of journey is kind of flourishing. I think for staff, it's really important to always ask for help and always facilitate the space for young people to make the decisions and not kind of impose anything. Yeah, I think like investment is really, really important, and the investment in young people's ideas is really prioritized. And we're kind of doing, like, at the moment we're working in partnership with Look Ahead, a housing association, and we're kind of embedded in one of their services in East London. And over the process of being going there and working with young people, we've developed like a core group of people who are really, really passionate about a whole range of different things and really excited to be able to get their teeth into like organizing and designing activities. And oftentimes it can look a little bit like we're just chilling out with them and like chatting, which is what we're doing in a lot of ways. But like also it's about like facilitating building that infrastructure to exactly what you had said there, Cara, about like building that community infrastructure whereby they're able to like actualize the things that they're passionate about and be like financially compensated for that, and be treated as professionals in a lot of way, as colleagues. And that's a little bit higher up the ladder, where you're like, you've done that relationship building, and then the goal is that they then lead on those projects. That allows them to like see, or it gives them the opportunity at least to like then move beyond that and think, right, if I can do that, then what's the next step for me? And yeah, for us to kind of essentially redistribute the resources into the hands of young people as much as possible. Because as you know, as important as the work, the workers in this situation are, like, if we can support young people to, remove themselves from be removed from poverty and like be paid for what they do, and then support themselves into like independence or whatever, like that's really the goal. And essentially we would want to be redundant in the relationship. So yeah, if you go on to the next slide. This is a bit of the process of what we're doing at the moment, and we'll talk a little bit about the challenges within this to co-production. Jess, I'll hand over to you.
Yeah, so the previous slide was sort of about the steps of what steps we're taking on the ground with the young people or whoever it is in the service you're in to build those relationships, and kind of make it possible to do co-production with them, provide the wraparound support, build up their confidence, encourage their ideas. That's all happening at that level. And I'll just give an example of like a project that came out of working in that way with once again, Khaled, another shout out to Khaled. He wrote a report alongside a member of MAC UK about the impact of school exclusion on him and his well-being and his mental health. And it's an incredible report, and we're hopefully going to publish it soon. So that's an example of like a youth-led project that came out of what was in the early stages, hanging out, doing youth-led activities together. And he's now contributing to our organization in so many ways, like how we evaluate our work, who we recruit, like really contributing in such helpful ways and bringing a voice that, a lot of things that we just wouldn't have thought about because we don't have the same lived experience as him. The outer layers are then showing all the work that happens outside of that direct work with young people. And I think there'll be people here today who are kind of working at different levels. So we encourage people to look at sort of the level you're at, but also look at how you can be impactful to the levels kind of either side of you, because we really believe that there are ways we can influence these systems, even as sort of frontline support workers. Yeah, so we can give a few examples, I guess.
Just before we do that, yeah, one of the things I just wanted to answer the question quickly about the challenges. Um, like one of the things that I've noticed over the time of doing like co-production with young people is like, so one of the challenges, of course, is like young people have their context, right? And I work for another organization and we employ young people as peer leaders, and you know, they are leading on a piece of work looking at you know, the how mental health impacts their community. Obviously those young people are living in very precarious environments. They're living in contexts that, you know, where they are targeted by the police, where maybe their housing situation is insecure, where their family situation is slightly fragile. There are a lot of different contexts, and I think one of the challenges is like making sure you're attentive to that and that you're providing the wraparound support. So it's not just like you're employing a young person to design like a project or an activity, and you just say like, and you know, just say like, all right, off you go and do it, and then you put all the labor and the workload onto them for essentially being compensated not as well as, you know, I am as my employment status within the organization, but actually like using that as a way to like offer support as well. So like when they are facing challenges in their context, you're acting as a support to them as well as like the employer, if you know what I mean. So I think that's one of the challenges, and that actually is not so much of a challenge. Young people, they do their thing, you know, they're dealing with their lives in the best way they can. And as a direct, like, you know, line manager to that young person, it's not so much a problem. But where the problem sometimes occurs is like the funding body, like where, you know, this project that I'm talking about is like funded by the state, and there's a reporting mechanism that is like quite rigorous, and that tied in with like trying to work with those young people through their context as well, and trying to like show that this journey is not just one of like, oh, they're just going to write a report for you, or they're going to, you know, it's actually to bring the young people and the funding organization into the same way of thinking, and like understanding that it's a slow process, and these things will take time, and that is a bit of a challenge. I think the other thing that can be a challenge sometimes is like kind of trying to shift systems. You know what I mean? Like especially working with staff who are doing such incredible work already, who are you know, really passionate about working with young people, and then like trying to like bring this way of working into places, and then but like the staff who are already doing the support work not being resourced to like have that time spent, and not, and like actually finding that quite difficult, and being able to like, yeah, build the infrastructure in at an organizational level that like that will enable the staff on the ground to do that work, I think is really, really important. And like Jess said earlier, that buy-in right from throughout the organization is a really, really important one. And I think one of the challenges for us is like how we communicate the work as well, because it can seem a bit like fluffy at some points, or it can seem a bit convoluted when we talk about like, you know, when people ask like, well, what are you going to do, our answer is often like, well, we don't know, because we haven't started working with the young people, and they will decide what we do, if you know what I mean. But yeah, I'll stop talking. Sorry,
Yeah, and I
Jess.
guess there's something about sort of traditional psychological approaches of like one-to-one therapy, these interventions that people associate with mental health support. They hold a lot of power, and they often sort of, it's often, if we're not doing that, then we're not doing mental health support. And there's a lot of work to be done with the systems around us for like shifting that understanding of like this in itself is a mental health intervention. And part of that is sort of evidencing it. And we do a lot of work with young people um, to invite them into how we're going to evaluate the impact of this. What is actually meaningful to you, rather than it being a top-down like questionnaire that someone's decided, okay, if they tick this, that means their mental health is better. We try and like really tailor that to the young people we're working with. What's a sign that this has been impactful, and then it's about sharing with the systems that this is more meaningful as a measure than like some of the measures that are traditionally used in the sector, if that
Yeah, I
makes
like that. That is the biggest challenge.
yeah, that's the biggest challenge, is
That is definitely the
evidencing it in ways that young people feel are meaningful, and then getting everyone else to kind of see that that is the measure they want to be taking, rather than, I guess there's pressure from commissioners to have a specific type of evidence, like the scientific numbers and whatnot. So I understand where that pressure is coming from, and people really, really ingrained in that way of thinking about mental health. We've got 15 minutes. I don't know whether we want to take. We did want to ask everyone to think about ways that you're already working in this way at these different levels, because I'm sure that a lot of you are already doing this work and maybe hadn't even realized that it wasn't a mental health intervention in itself. But maybe it's more important to think a bit more about the challenges together, because there's more challenges to work in this way. Or maybe it's better to just have questions. I don't know what.
Yeah, I think if you go to the next slide, so essentially these are some of the questions that we had for you guys, how you're working in these ways already, how would you like to kind of work more at these different levels and support the mental health of people you work with, and what barriers there might be to working in these ways, and how to navigate that. That's kind of some of the questions that we had for you, but also if you've got any questions for us, we would like absolutely welcome them, and yeah, I think to open up the space to you really for this last kind of 15-13 minutes, to if you had anything that you wanted to think about. But if not, it would be great to hear a little bit about, yeah, the kind of things that you were doing, and where you think the opportunities are for you to like build co-production into your work, and also like to think about like potentially how you can work at different levels, and like where you might be able to, where you see the opportunities to get buy-in at different levels, whether that be within the state infrastructure or through charity, or yeah, however you might see it. So Rosie says the discussion with colleagues across Northern Ireland is that often the same young people are targeted for participation forms and similar. That is so true. Like often working in children in care councils, there are so many like they're working with like young people in care who participated in those things. Like they were very driven, and like there was often like, this is not obviously like a blanket thing, but like often those people who are kind of palatable, let's say, are chosen to like represent like the participation, represent the work that's being done, and the people who are maybe less palatable are missed, or maybe less reliable, or like a little bit more resistant, missed in
Need a
those
bit
kind
more
of
support.
participation activities. And actually like that's not because they're a problem, that's because the infrastructure hasn't been built to support those people in the way that they need to be able to participate. And I think that's really the key, like the core, at the core of what we're trying to think about, is like how do we change the way that we work so we can support the people who need it the most, right? So that's where Mac was kind of foundationally built from, and that's why we changed our approach. We're changing our approach all the time. We can always participating as a organization in learning spaces and like trying to, better understand where our positionality within relationship to young people we're working with and what actually is most relevant for them.
Yeah, and I guess that comment in the chat made me think that if we're only working with the same kind of young people that are on these panels co-producing, we're almost replicating the problems in the mental health services that we're working with. We've made it accessible to this group that are able to engage with it, but we haven't provided the access support for this group who haven't yet been able, like there's stepping stones for people to get them to a place where they're ready to sit in a meeting with like board members, for example, which could be a terrifying, alienating experience for some young people. So yeah, thinking about not replicating that exclusion again and designing it. And it does require resource and buy-in and yeah, staff to have capacity to give that wraparound support and scaffolding, so young people can engage and go as slow or as fast as they feel able to in contributing. And starting with their interests is like usually a great first step, like youth-led activities. Yeah, were there any more? Okay, there's more. People giving some examples of like co-production they've been involved in.
Wow, the Homeless World Cup, like a football tournament.
That's cool.
That sounds quality. That I've like often, a few of the examples of like co-produced activities. Like, yeah, I think the use of sport and art, and actually we haven't touched on this at all. But like, yeah, sport and creativity and art, like music, like these things are really, really fundamental to people's well-being, like not just the actual kind of exercise or anything like that, but like just the ability to give people the freedom to know that like actually they can do those things and not, it doesn't have to be an add-on or like something frivolous. It's like something that they can participate in that is like really, really meaningful and supportive of mental health, and like, using those things as a way to like engage people and support them to develop their own projects based around those things is really, really, yeah, really important. Yeah, so we like in Barnet I work for an organization called Art Against Knives, and we embedded in the community, and young people were, said we want to have a music studio. So we essentially built a music studio together and did that. And then there was like a desire to run a podcast. So we like facilitated that. And I think something that's really, really important is like being responsive to the community and the desires and like not just the needs, because again, this is the thing that I was touching on a little bit before around like that there are basic needs that people should all have, but also like the things that make life beautiful and joyful are the things that are like really, really fundamental to people's mental health and well-being, and like there is no reason why those things should be less accessible to people who are facing difficult circumstances than, people who are not. Yeah. I think, yeah, I think art and music and it's all brilliant.
We have 4 minutes left if there are any questions or closing comments or thoughts that people want to share. Someone has commented about there being like a training fund and being interested in Mac UK doing some training for frontline workers. So I've saved that so we can think about it with our team and see if that's a possibility. Sounds like a great opportunity.
Absolutely. And yeah, I just wanted to say Rosie had in the Q&A has just highlighted, not just, but before highlighted the campaign to make care experience a protected characteristic. Now, I thought that passed. I might be wrong, but I thought it did. I'm sure you will know better than me, to be honest. but yeah, I just think like if it hasn't, then it's really important to get involved in that. And yeah, just wanted to highlight that. Thanks, Sharon, and everyone. Oh, there you go, Rosie. Rosie knows what's up. 90, right. It's not in the Equality Act. I don't know why I thought it had come through. I mean, this is a perfect like example of like thinking about the most. So we've been thinking about organizations at an organizational level, but at a population level, this type of legislation is super important to like be engaged with. And one of the slides where the integrate model, like that top level of like engaging young people in social action projects, like that is exactly the kind of thing that that we want to be facilitating within co-production, and like because like supporting young people to be compensated, financially compensated for being like active members in their community, and also making social change, highlighting some of the key challenges that they face that are like that have been legislated for. Where I was talking about housing, like these are key things that are like you can work with people on to like support the change in legislation, build campaigns, write letters to your local MPs. You know, these things are super, super important. And that's the kind of like, you know, the people you're working with will have the answers to the challenges that they're facing. And it's about facilitating those things. Nice one, Rosie Meek. Yeah, absolutely. I mean, like this is that is one of the key challenges, I think, is so many like, you know, so under-resourced and people are so overworked, but you know, everyone out here is doing incredible stuff. And yeah, I really, really appreciate your time and for being so engaged. And yeah, I just hope that we've enabled you to be able to think about things that you can take away and use in your work back on the ground. I just really wanted to shout you all out for doing the work that you do, because it's so important. And yeah, really appreciate it.
Yeah, thank you so much, everyone. Someone's just shouted out our website. It is a little bit out of date, so bear with us. We're updating it, so it's going to be all new and shiny soon. But yeah, you can find us there.
Yeah, absolutely.
I believe we've got back on Twitter recently as well.
And
So
feel
yeah.
free to like grab my email and yeah, our emails from St. Martin's in the Fields. And happy to like answer any questions or connect over email as well.
Yeah. Thanks so much for having us, St. Martin in the Fields as well.
Yeah, appreciate it.